someone's day, get you that job you were looking for, or get you that date you were trying to get. A smile is very important. It's even more important to keep it looking nice every day. Well, here to help us achieve that winning smile, Dr. Rodney Leibowitz, from here on in referred to as just Dr. Rodney. Thank you for joining us, sir.
Thank you.
All right, so listen, there are foods, there are products, there are ways to take care of your teeth. Let's start with these foods right here, because I'm looking at bagels, which I usually eat every day for breakfast. Now, we're not talking about really, per se, keeping your teeth white, but these could be damaging to your teeth right here?
Well, like a bagel is not specifically damaging. It's what happens when you bite into it.
Okay.
If you bite into it and chew it, fine. But if you're trying to rip with it, there's always a chance you can fracture a tooth. Because as you get older, teeth become a little brittle.
Right.
And if you're pulling too hard with a bagel, be careful. If you toast it, go to town.
Right. I'll say, so we're looking at just up on the screen here. So the good foods for your teeth, apples and carrots, right? Which
apples and carrots are fabulous. It's almost like using a toothbrush on your teeth.
Right.
The biting force of it, it actually cleans things off of your teeth.
That's great. And of course, we're looking at a little candy here. You know, sugar, everybody knows, bad for your teeth, no good, stay away.
Well, it's not that it's bad for the teeth. That particular piece is a hard piece of candy. Now you're dealing with a hard piece that can crack a tooth. Then you're dealing with sugar, which is broken down easily by the body.
Right.
And when it's broken down, the byproducts is what causes acid, and it burns into the teeth and causes a cavity.
Okay. Diner owners of America cringing right now, because these are on every, as you walk out of every diner,
You need one to refresh.
Right. Let's talk about some of the products you have here for teeth whitening. Some over the counter, some provided by dentists themselves. Tell me which ones are good.
Well, they're all good. They all do a job. But the one thing that people have to understand is, before you start with the whitening, you got to have your teeth cleaned. And I don't mean cleaned with a toothbrush. I mean professionally.
Right.
Because there's extrinsic things like tartar and perhaps some food and some coffee stains that we can get out. And then these particular whiteners work well. Now, some of them over the counter, they're not the same strength as some of them that the dentist has. This particular one I use from Opalescence, I happen to like it. I like it because it has its own tray that custom fits a patient.
Okay.
And it's only worn for 40 minutes once a day for 10 days.
Once a day for 10 days, and that will whiten your teeth. Now, do you get the little clinging and pinging in the gums that you get when you do it professionally?
Sometimes you do, but we can give you other products that'll get rid of that. It's really nothing major.
And let's talk about flossing. Dentists always say you have to floss, but if you're doing it the wrong way, it could be detrimental, right?
Well, actually, the ADA came out recently, about 2 months ago, saying that flossing isn't something you must do. And the truth about flossing is, when you floss, you can cause inflammation. And whenever there's inflammation in the body, there's a myriad of things that occur, and a secretion of a liquid comes out that is detrimental and melts the bone. So you want to be really careful how you floss.
Okay, and talk about, when you're looking for a toothbrush, do you want the, you can get the soft, the medium, the hard toothbrush, the bristles. Which ones are best for taking the best care of your teeth? You
should only use a soft toothbrush. First of all, the hard toothbrush wears away the enamel, can hurt the gums tremendously.
Okay.
And the soft one is better for you because you have more control.
And when you talk about the cleaning of the teeth, is it still you recommend 6 months, every 6 months to go?
It depends. Now, myself getting older, every 4 months, because things change in the body. You're a kid. Well, kids think they're immortal. They'll go every 5 years, but they should go every 6 months.
All right, and what about a before and after a procedure? Tell me about that.
Before and after in which respect?
And the procedures as far as the teeth whitening. Which, when you look at these, which ones do you recommend as far as the before and after? I think we have a shot of a teeth whitening up here, yes? All right, so this is the before and after of a teeth whitening right here.
Well, no, that's actually a patient of mine who came in with some challenged teeth.
Oh, that's an actual patient of yours?
Yeah.
Oh, okay. So what was the procedure you did on that patient?
We did some caps on her.
Okay.
She came in with some teeth over the years, and I always talked to her about just doing something that could improve and enhance her life.
And
so we ended up putting some caps.
There's a little. That's the video of you putting the caps. I'll tell you, boy, what a great smile she has right now.
Beautiful. This is another gentleman. Actually, this gentleman, I put some implants in.
Okay.
I use a system called Shatkin first, where it goes a little differently than others. Instead of taking perhaps 6 months to a year, this particular implant is a small diameter implant. And it could be used quicker, and the teeth can be put in immediately instead of loading it, putting a tooth on in 6 months to a year. It's to me, the most user-friendly and actually the least expensive way to put an implant and restore your smile.
Dr. Rodney, thank you, my friend. Dr. Rodney Leibowitz, for more of his advice, go to our PIX 11 app and click on the extra tab. Suk.
Don't you want to run to the bathroom and start brushing your teeth right now? Like, right? Start
Clean 'em up.
flossing and doing all that.